The U.S. has again broken its record for coronavirus cases, reaching more than 100,000 new infections in a single day. That brings the country's case total close to 9.5 million since the pandemic began. More than 233,000 Americans have died as a result of the virus, and experts say that we should expect even more infections as we head into the winter. Meanwhile, a new study out of the UK suggests that some adults could have immunity to COVID-19 6 months after first becoming infected. So Dr. Shoshana Ungerleider is joining us now from California with more on this. Doctor, let's talk about these numbers first. There won't be an approved vaccine until potentially 2021. But with the partisan fight on how to handle the pandemic, there is hope that America will be able to buckle down without a vaccine. And I know we focus a lot on a vaccine, but there are so many things that we can do to bring this pandemic under control without it.
That's right, Anne Marie. You know, I think high level, we're clearly not rounding the corner on COVID-19. We just hit this record for new cases in a single day for the first time. This is terrible. The virus really is spreading unchecked. The United States is not in a good place. And regardless of who wins the White House, we're in for a really tough winter. I think we are where we are largely due to a lack of leadership from this administration on a public health response. But we can all step up and make a difference right now. You know, we do have strategies that work while we wait for a vaccine and treatment options. We all need to be wearing masks, continue social distancing, not gathering in groups with people outside of our homes. We know that a major contributor is informal gatherings with family and friends. So it's so critical, you know, as we head into the holidays, that we use as many precautions with our loved ones who we don't live with as we would with strangers. We've already saved so many lives with all of our hard work this year. We can save so many more if we keep this up.
So, Doctor, let me ask you about the increase in infections and what that could possibly mean for herd immunity, which is something that we've heard before. Often we've heard it from the president, some of his supporters, this notion of herd immunity before there's a vaccine. But I just sort of sometimes, and again, I'm not a doctor and I'm not a politician, but I just feel like I don't want to take the chance of living in a world or in a city where we're just rolling our dices with herd immunity.
That's right, Vlad. You know, let's define. So herd immunity happens when enough people become immune to a disease to make it spread much, much lower or stop altogether. There's actually two ways to achieve this, right? Through getting the infection or through vaccination. You know, with COVID-19, obviously, we don't have a vaccine. People are talking about this idea of herd immunity through natural or community-wide infection. So this is exactly what you said, allowing the virus to go completely unchecked. This would require a very large percentage of the population being infected. We are not at that place. This would come at a cost of massive amounts of illness and death, which is not a viable option, you know, for so many reasons. And this is why a safe and effective vaccine is so important and the right approach to achieve herd immunity.
So we are now entering into flu season, and I'm sort of curious because part of the challenge of COVID-19 is that there is an overly robust immune response within the body. It's almost a little bit, it's like all kinds, it's like a respiratory illness that also affects your, the circulatory system. It's like a flu, but then it also is almost like an autoimmune situation. So because of this like robust immune response, can you still contract other things? Like, could you get both the flu and COVID simultaneously?
Oh, you absolutely can. And that would be, you know, terrible. You know, I think one positive thing when we do talk about the flu in the setting of the pandemic is that the same precautions that protect us against the coronavirus also protect us against the flu and other viruses because they're spread in a respiratory fashion. However, I do want to point out, you know, the direction that we're going, as I said, is not good. You know, COVID infections are going up hospitalization rates are following, and then unfortunately we're going to see deaths increase here. So this flu season is going to be particularly hard, and hospitals across this country are frankly nearing their breaking points. This is just the beginning of our flu season. And so people need to be extra careful. Our doctors, our nurses, our respiratory therapists on the front lines are exhausted, and healthcare systems are already being impacted due to COVID because of limited amounts of medication and PPE and staff, which also means that the care of patients with non-COVID conditions like the flu, right, heart attacks, strokes, are also going to be compromised as well. So this really affects everybody's ability to get good medical care. Patients can only get good care if we have enough hands and enough supplies and beds to go around. And when a healthcare system gets overwhelmed, you have negative health outcomes across the board. So we really need to do everything we can right now to avoid that. And if folks have not already gotten their flu shots, do it right now.
Doctor, practically speaking, for people who are worried, I think I saw a reporter that I follow say, entering the season where when you get the sniffles or you get a runny nose or you have a cough, is it a cold? Is it the flu? Is it COVID? I mean, how would you know? How would you know if you were just battling the flu and not COVID-19? Are the symptoms different or are they similar?
A lot of them are quite similar. As you pointed out, COVID can present with a number of those upper respiratory type symptoms. The cough tends to be a little more dry. That loss of taste and smell is more common with the novel coronavirus than probably the flu, but it's a little tricky. And so I would definitely say if you're starting to have symptoms, definitely isolate, from others and think about, calling your doctor if things get worse.
I didn't know sneezing wasn't I just was looking at that, and I didn't realize, Anne-Marie and Dr. Ungerleider, that sneezing was not an indication of the flu or of COVID-19, because I tease my wife every time she sneezes in the house. I go running for the other room, and so I won't be able to use that joke on her anymore.
No, probably allergies. But we know when we hit allergy season, all of us started to wonder, is it COVID or not? It's just it's hanging over us no matter what. So a new study in the UK, doctor, found that T cells could potentially provide immunity to adults 6 months after infection. That sounds pretty good. As we learn more about the virus, how significant is this?
Well, Anne-Marie, some of the questions that we've been trying to answer for a while now are whether previous infection with the virus gives you immunity to reinfection, and if so, for how long? The immune system is extremely complex, so this is not a straightforward issue. A study just came out of the UK, which followed 100 people who tested positive for the virus, and they were asymptomatic or had mild illness. And what they did was look at the degree of their T cell response, which is a component of the immune system. And this response was present 6 months out and was about 50% higher in people who had symptomatic disease at the time of their infection. This is interesting. Right now, though, it's not clear whether this immune response lasts over the longer term, so beyond that 6-month mark, and if the strength of the response correlates to the likelihood of becoming reinfected. So it's more information about this challenging virus, and I think will inform the process for vaccine and development and treatment. But we do need much more study in order to answer some of these key questions about immunity.
All right, Dr. Shoshana Ungerleider, always great to have you, doctor. Thank you so much.
Thank you.